Informative speech on Chiari 1 malformation. Take 3 million. Here's my audience. Again. Okay. What if I told you that my brain was falling out? Sounds unbelievably absurd, does it not? Well, I can assure you that this very real condition is called Chiari 1 malformation. The congenital condition literally means that my brain was falling out of my skull. This is a more common condition than most people realize, and as I have found, doctors haven't even heard of. I cannot tell you how many times I heard, "It's all in your head." How correct they were. They just didn't realize it. Now you may be asking, how can this happen? Let me tell you what Chiari is, how it occurs, and how the doctors were able to give me much needed relief after 3 years of pain. Along with the medical references to give you the technical side, I can also add my own personal experience of living with this condition and then finally receiving the surgery that relieved my pain and suffering. What is Chiari 1 malformation? In the 1890s, a German pathologist, Professor Hans Chiari, first coined the term for certain abnormalities of the brain. There are 4 types of Chiari charted to date, but today we're going to focus on type 1 because that's the type that I have. Chiari is an abnormality of the brain where the skull and the spine meet. According to the American Association of Neurological Surgeons, among the cerebellum is the 2 hemispheres of the brain, and under those are 2 small protrusions called tonsils. No, these are not the tonsils in your throat. Your brain has tonsils too. The 4th ventricle, or the cavity, behind the brainstem is filled with cerebrospinal fluid, or CSF, as I'm going to call it. All of these are located above the foramen magnum, the largest opening at the base of the skull, where the spinal cord connects to the brainstem. The Chiari condition is when the tonsils herniate more than 4 millimeters through the foramen magnum into the cervical spinal canal. My particular herniation was 15 millimeters through the foramen magnum, and that is really large for a Chiari patient. The herniation causes a block of the CSF, making its pulsations irregular, and that's where all the problems start. Now, one might ask how Chiari 1 malformation occurs. Chiari is a congenital condition that begins with the underdevelopment of the fetal skull in utero. No, my head is not shrunken, and it is not outwardly abnormally sized. I was a very late-term delivered baby. My doctor suggested that my overbaking may have solidified my skull before my brain was done growing, and therefore led to my condition. During a study from the Mayfield Brain and Spine Clinic, it was found that in childhood, when the brain develops, the skull of a Chiari patient is mismatched to the size of the brain. Chiari occurs in 1 in every 1,000 births and affects 3 times more women than men. Some studies have found that it tends to cluster in families and that it is a mutated gene that has been passed. The condition can present itself during adolescence or adulthood. According to my neurosurgeon, my Chiari presented symptoms after delivering a 9-pound baby. The herniation happened because of pressure pushing on the back of my skull and my spine while applying downward pressure, such as giving birth. The neurosurgeon said that generally when something traumatic happens, such as a car accident or a serious fall, the symptoms of Chiari become apparent. Though I had had the condition my entire life, it wasn't until the herniation that the symptoms appeared. Symptoms vary from person to person. The Mayo Clinic classifies symptoms of a patient can experience with neck pain, balance problems, difficulty with fine motor skills, numbness in the hands or feet, dizziness, difficulty swallowing that can lead to gagging or vomiting, ocular disturbances, and sight problems, and the most common is severe headaches. The headaches generally occur after sudden coughing, sneezing, or straining, causing a buildup of pressure in the brain. My personal symptoms included all of the above. 2 include cluster headaches, where I would have 6 back-to-back headaches that would cause me to black out for a few seconds or lose my vision in my left eye. The headaches would come in spurts, but always from the base of my skull. The only relief was putting my head in between my legs, which I found out later was because it pushed my brain back into the regular position. They would last anywhere from 15 to 30 seconds and happen 30 to 50 times a day. Due to my sinusitis, anytime I would have a cold or a sinus infection, the headaches would flare up and cluster. Lesser-known symptoms include ringing in the ears, weakness, slow heart rhythm, scoliosis, and abnormal breathing leading to sleep apnea. Any of these symptoms could mean a number of things, but it would be wise to be seen if all of these symptoms are being experienced. The majority of cases of Chiari go undiagnosed and accidentally discovered exploring other medical treatments, generally because the patient is experiencing the symptoms mentioned previously. An MRI and all of my findings and personal experience is the best way to find herniated tonsils. The MRI findings have to be larger than 3 millimeters dissection to require a brain decompression surgery. The decompression surgery that I had was the most widely used technique. The technique consists of removing the bone with a craniectomy at the back of the skull and the spine to widen the foramen magnum, or the skull opening. The surgeon will open the dura, or the tissue, holding the tonsils, and sew in a tissue patch or a skin graft to extend the space safely. This creates a brain cradle for the tonsils to sit in, and it allows the CSF to flow normally again. The skin graft used to make my brain cradle came from my outer left thigh. My hair had been shaved about 4 inches up the back of my head, and staples were placed to seal the wound in the back of my skull and on my thigh. The hospital stay was roughly about 4 days in the ICU, and recovery was about 3 months. Though I felt fine about 3 days after, I had specific instructions to not be Wonder Woman and allow my body to heal, which, of course, was the hardest part. In many cases, a patient may have Chiari and never know it. It took me 3 doctors, multiple imaging sessions, with the original idea that the problem was in my sinuses, to find out that I have Chiari 1 malformation. After finding out about my own condition, I found out that 3 people that I know also have it. The Chiari made life miserable, and I had forgotten what not being in pain was like until after having the decompression surgery. 3 long years of process of elimination before I finally broke down and went and saw specialist help. There are still studies being conducted to determine if this condition is genetic or strictly congenital. I make sure to monitor my children's headaches in the event that it is indeed genetic, though nobody else in my family has symptoms. Being that this condition is highly overlooked, I encourage the spread of the knowledge of Chiari, if that makes it so one less person has to suffer with these horrendous symptoms. At the end of it all, I have a super awesome scar, serious relief, and a slogan of too much brain to contain. Thank you.